Now we are holding the 17th meeting within the framework of the series of workshop Contemporary Area Studies, the project of the School of International Regional Studies of the Faculty of World Economy and International Affairs of the HSE University. Our discussion will be devoted to the challenges of the COVID-19 pandemic in Morocco. From the early stages of the novel coronavirus outbreak, Morocco adopted drastic measures to try to contain the epidemic. On March 20, as I know, when the state of emergency was officially enacted, the country only had 77 cases. Public events were suspended, movement within cities were firmly controlled, and intercity as well as international travel were suspended. The strict measures imposed early on were prompted, among other reasons, by the health system limited capacity to manage a potential wide contamination wave. Morocco's public spending on health remains relatively low compared with regional peers. Today, over 3 months into the crisis, Morocco has one of the lowest fatality rates. It's about less than 2.6%, and 20% of the cases have already recovered. By imposing strict lockdown rules, Morocco managed to contain a wider spread of epidemic, sparing the health system and its public sector doctors from severe stress. But is it a real success story or just another case of information asymmetry? And we will discuss it with our key speaker, Hamid Ait El Caid, or El Caid, I'm sorry.
Ait El Caid.
Ait El Caid, Moroccan Independent Political Analyst from Marrakesh, Kingdom of Morocco. He completed his bachelor degree at the Moulay Ismail University in Meknes in Morocco, and his master degree in our alma mater at the HSE University in Moscow. He is a member of International Youth Alliance and member of the non-governmental organization Together as One for Community Development, and etc. And as far as I know, his area of interest are international relations, conflict studies, and public policy in Morocco, Tunisia, and Algeria. So, but before we started with our expert, online with us also Dr. Vera Vishnyakova, the head of the School of International Regional Studies of the Faculty of World Economy and International Affairs of the HSE University. And now I want to give the floor to Dr. Vishnyakova for welcoming speech. Please, Dr. Vishnyakova.
Okay, thank you very much, Murad. Thank you very Hamid for joining us today, and dear colleagues, friends, and guests of our seminar. Firstly, I'd like to thank all of you for joining us today and express my sincere appreciation to Hamid, who generously agreed to explain the current situation in Morocco. And it's really a great pleasure for us that the graduate student, yes, has joined us today, and I see that the connection between the university, between the country, is really working. I read that there are more than 9,000 cases in Morocco, and this number is increasing, connected with COVID. As experts, we would like to know from the primary resource how the situation in the politics and economics will develop, and what measures does the government do to support the citizens. And we would like to know your point of view about the period when the crisis connected with COVID-19 will overcome. I think it will be interesting for us, and it will be really interesting presentation. I will be grateful if you explain the current situation and express your opinion. Thank you very much, Murad.
Thank you so much, Dr. Vera Vishnyakova. Now, dear Hamid, floor is yours. I hope you will tell us interesting and not stressful information. I mean, maybe some positive information. Yes. Now the floor is yours, and one more time, thank you that you accept our invitation and to be with us today. Please.
Thank you, Murad. Thank you, Vera, for inviting me to this online meeting. It's a great pleasure for me to deliver this presentation about the situation with COVID-19 in Morocco. And thank you also for the introduction. I prepared an introduction similar to the one you just gave, so I'm going to skip it. My presentation is going to be divided into 3 parts. The first one will be a presentation of the current situation with COVID, with COVID-19. So I'm going to give some numbers about the development of the virus in Morocco, and later on we move to the response, which is multi-dimensional response by the government and also by the civil society organizations, which is also very multi-dimensional. And later on, we talk about the main challenges of the response. So Morocco being in let's say in North Africa, the crossroads of Africa and Europe, it has managed to overcome the worst scenario. I will talk in details about this. But of course, there have been expenses of this response and very let's say drastic consequences at the socioeconomic level, at the educational level as well. And later on, we talk about the prospects. Prospects are like what can happen or what can change after this pandemic here in Morocco, especially in terms of health sector, expenditure, and also public policy. All right. So now we shall start with some numbers about the current situation with COVID-19 in Morocco. Currently, Morocco record, as Vera mentioned, exactly 9,042 confirmed cases as of this morning. Okay, the number of deaths reached 213, and the number of recoveries is now 7,960 recoveries. The number of active cases in Morocco is 830. Active cases means that means people who are currently being treated in hospitals. Okay, so I would request Murad to show the slide which can explain the development of COVID-19 in Morocco, so you can see exactly how it is developing and how the number of confirmed cases together with the number of recoveries and also the number of deaths are being interrelated. So the slide at the top shows the number of cases. So the red line shows the confirmed cases. This is the accumulation of the cases, the recoveries, and the deaths. Okay, so the red line is the number of confirmed cases. The green one is the recoveries. As you can see, it is still increasing. The recoveries are increasing, and the cases are also increasing. Even though the line is going to be like in a stable, it's almost on a stable, let's say, situation. While the green line at the in the bottom is the number of deaths, which is a great news. Okay, in the late days or in the last days, Morocco records low rates of deaths. The second line showed the number of confirmed cases. Okay, and as you can see there, in the month of April 17, it records the highest number of cases, 281. And that's exactly the period when Morocco, let's say, obliged the citizens to wear face masks. All right, and then the situation later on, it starts to decrease. It goes up, it goes down, it goes up, it goes down, but it's not as worse as it used to be in April or March. And the reason why there is this, let's say, a very, let's say, dynamic development, it's because each time the health authorities discover epicenters. Epicenters are like outbreaks within some places of work, in companies, because, you know, if you stop people from working, the economy will be crushed, and the very sensible and essential sectors like food processing, they were working since the state of health emergency was developed. And the last, I mean, the third slide, or the third graph, shows the number of deaths. Okay, so as you can see, in 27th of March, the number of deaths reached 13 cases, but it gradually goes down until, like, sometimes for 4 days in a row, the authorities doesn't record any case of death. This is because of a protocol of treatment that has been implemented by the health ministry. Okay, I will talk about this as well. And the last one is how many recoveries. All right. So as we can see, in 2nd of June, 517 recoveries have been recorded. This graph shows daily records, by the way. Okay, and then the recoveries goes, let's say, up to 50, 60, 70, sometimes 40 per day. Okay, so now you can go back to the normal, let's say, screen. So after we give a general overview about the situation with COVID-19 in Morocco, we go to the multidimensional response to the pandemic. It has been initiated by the government and by the non-government organizations. So as soon as Morocco sensed the risk of COVID-19 entered into the country, the King of Morocco, Mohammed VI, held on March 17 a special meeting with key figures of the state, including Prime Minister Sa'd Al Uthmani, Interior Minister Abdel Wafi Leftit, Minister of Health, also some figures or top figures from the security services. Much of the attention and action was devoted to strengthen and reinforcing healthcare capacities in preparation for worse scenarios. So this meeting outlined the main guidelines of the response. Okay, so now we move to the health dimension. What response in the health dimension was being implemented? As soon as the first cases of COVID-19 were recorded in Morocco, the Ministry of Health mobilized its human, technical, and logistical resources to receive patients and monitor the situation 24 hours, 7 days. For this reason, the government allocated 2 billion dirhams, which is equal to 204 million US dollars, to the Ministry of Health to be used in the purchase of necessary medical equipment. As a result, the Ministry of Economy and Finance said that 406 intensive care beds were purchased, bringing the total to 3,000 in total in the country, in addition to 580 normal beds, as well as 410 respiratory ventilators. Most of this equipment were imported from China and South Korea. Furthermore, the king ordered to activate military hospitals and to set up 2 military field hospitals with total capacity of 560 beds. By the way, these 2 hospitals now they host the total number of cases in Morocco, after they have been hosted in different civil hospitals. Okay, it is a decision to ease and to relax a little bit the civil hospitals to receive patients who have other diseases. Also, another anti-COVID-19 field hospital with a capacity of 700 beds, including 6 intensive care beds, was constructed in Casablanca, which is the largest of its kind in Africa. It was constructed in 2 weeks. Between May 14 and 29th, the Ministry of Health recruited over 852 nurses and medical technicians so as to strengthen the human resources. The ministry also canceled seasonal holidays or leaves for all healthcare staff, including doctors, nurses, and employees in the administration. By mid-April, the Ministry of Industry produced over 500 Morocco-made ventilators, which is great in the country, and more than 2 million units of face masks daily by early June, securing therefore local needs of face masks, which also give an opportunity for the government to export them to 11 countries, So 18.5 million units of face masks were exported to abroad, as announced by Minister of Industry. With regard to testing, as of June 7, Morocco increased the number of tests and laboratories, as Prime Minister Sadygzade Al Uthmani revealed that more than 17,500 tests are being conducted in 24 laboratories across the country. While in the beginning of the pandemic, only 3 laboratories conducted the tests of over 2,000 every day. Mobile testing laboratories also have been gradually deployed across the country. Mobile testing are like trucks who deliver the testing operations to prospective COVID-19 patients. At the communicational level, from the government to the people, so 2 hotlines were introduced to public for anyone who seems to have symptoms similar to COVID-19. So the ministry would assist prospective cases to the hospital for testing and treatment in case of confirmed infection. So if I have symptoms of the virus, I can call, and then the ministry will arrange transportation for me and also to do the test. Ministry also, Ministry of Health, of course, also used social media to advise people and give them precautions to prevent the spread of the virus. Such practices include good hygiene, social distancing, and correct way of wearing face mask. So as we will see in a slide later on, we will see that the level of communication is pretty high, and it helps the people understand what's going on and also understand the precautions they have to take to ensure their safety. Also, very recently, the Ministry of Health, in partnership with several stakeholders, launched the app, which is called Wiqaytna, means our protection. It's an application which can be downloaded in all smartphones, and it can help to trace prospective cases of COVID-19. The app is made for public on voluntary basis, so it's not obliged that everyone have to download this app. It uses Bluetooth to track all possible users who might be in contact with a confirmed case. So it helps, therefore, the Central Healthcare Services to support its main strategy in tracking COVID-19 cases in fast pace. Some countries like Italy have also used this app in order to get more cases and track them. Now we move to the legal dimension of the response, which is one of the most important ones, which also have helped to contain the virus. Successful implementation of lockdown measures requires legal basis to operate. So on March 20, Morocco adopted the state of health emergency, which gives extensive powers to the public authorities to take suitable measures aimed at containing the virus. The decision took place after a series of actions such as suspending sporting, artistic, and cultural events, and closing maritime and air and land borders, which are still closed up to now, as well as mosques and schools. They are still closed. Other non-public spaces such as restaurants, barber shops, and gyms were ordered to close. Right after the state of health emergency was adopted, more restrictive measures were ordered, which matter suspension of intercity transportation and recruitment campaigns. Consequently, so as a last measure, the authorities announced that everyone must stay at home, except for buying food or medication or for urgent work. On this regard, a document has to be carried with anyone going out, which states the purpose of his movement. Violation of orders within the framework of the state of health emergency will lead to jail between 1 to 3 months, in addition to a fine ranging between 300 dirhams to 1,300 dirhams. 300 dirhams is about 30 euros, okay? Between 30 euros to 130 euros as a fine for anyone who violates the orders of the state of health emergency. On April 6th, as the number of COVID-19 soared, increased for a third time, the government announced that face masks have been mandatory. So the face masks were not compulsory in the beginning. When the government saw that the number was increasing, then they ordered that everyone must wear face masks. The new measure created public frustration because it came into force one day after it was announced. So again here, the problem is that some decisions were not planned in advance. For example, the face masks were implemented just a day before. So for example, today the government says tomorrow you have to wear face masks. So it created some, let's say, frustration, given shortage of face masks at that time in pharmacies and grocery stores. However, within 2 weeks, textile companies managed to exclusively produce face masks until they meet public need. On April 15, a total of 25,857 people were prosecuted by public prosecutors before the courts of the kingdom for violation of the state of health emergency. So about 26,000 people were arrested because they violated the state of health emergency, of which 1,566 were brought before the courts in state of detention, according to the General Prosecution of Morocco. Among these people are 2,593 arrested people for not wearing protective mask. All right. So as you can see, the authorities, in line with the police and also the security authorities, they have strictly imposed this law. In addition, the public prosecutors' offices opened 93 judicial investigations against people who allegedly spread fake news. So what do I mean by fake news in this case? In the beginning of the pandemic in Morocco, many people, or like at least some individuals, they have like posted some content in the media urging people to break the state of health emergency, and some of them, they were arrested for let's say for saying that the virus does not exist at all. So as I said, it creates a big issue in terms of trust of the correct information. It should be also mentioned on this regard that Moroccan courts have started to conduct trials through online platforms with the help of communication technologies. For example, 5,216 detained persons have been sentenced through online trials by May 13, according to the High Committee for the Judiciary. So this will bring us to talk about the communication technologies and how they have helped very much in the process of the response. State of health emergency has been extended 3 times since March 20. So on March 20, it was when it's the time when it was adopted. It is still in effect until July 10. However, confinement relaxation measures have been introduced amid strict precautions and according to 4 principles. So now Morocco has started to relax a little bit the lockdown measures, but as mentioned by Prime Minister Sadygzade Al-Uthmani, these measures are based on 4 principles. So the first one is the gradual relaxation. They are not going to remove the lockdown at once. It will be a disaster. Okay, so they do it step by step. The second one is the geographical aspect. So some regions in Morocco, like the southern regions, they haven't witnessed any case for over 20 days. So it doesn't make sense to keep people at home. This is the second principle. The third one is flexibility, which means that regardless of this confinement relaxation, the authorities are always alerted to in case of rise of cases, they can ask people to stay at home once again. And the fourth one is differentiation. It's taking care of the elderly people and those who have chronic diseases. So in spite of the relaxation of the lockdown, this category of people have to stay at home. Okay, now we move to the socio-economic dimension of the response. So what the government did in order to counter the consequences of like thousands of people who stopped working because of lockdown. In a bid to ease the effects, authorities announced they would double the currency trading band. On 29 March, so this is part of the socio-economic dimension, the financial measure, okay? The Central Bank of Morocco announced a series of monetary measures to support access to credit for businesses and households by enhancing banks' refinancing capacity with the central bank. Also, a new fiscal law was adopted to allow Morocco meet its foreign exchange needs, in particular through the use of borrowing on the international market. As a result, the Central Bank of Morocco received $3 billion from the IMF, International Monetary Fund, as a debt to be paid in 5 years. And just yesterday, I read that Morocco also requested from the World Bank a similar amount of money. The fund that was launched by the King of Morocco, I forgot to mention this special fund. It was a fund that was launched by the King of Morocco, which was a contribution of individuals, of businesses, of banks, and so on. The fund valued as of April 28th about 32 billion dirhams, which is about $3 billion, including 10 billion from the state's budget and 1.5 billion from the regions, the municipalities. This fund builds on the solidarity and contributions from the public sector, companies, and private individuals who committed to financially support the country's efforts to contain the virus and mitigate its consequences at both the social and economic levels. Foreign development and financial institutions have also contributed to the fund, such as the European Union, about 150 million euros, and the French Development Agency, about 100 million euros. Okay, so as you may know, or as you may not know, the European Union is Morocco's top trade partner for Morocco, and so it's not for the interest of the European Union to see Morocco suffering from a lot of consequences, because there are many imports from the country. The fund is monitored by a special committee within the Ministry of Economy and Finance, known as Yaqada. In Arabic, Yaqada means watch committee. Okay, as lockdown and closure measures were enforced, millions of employees in the private sector and businesses stopped working, including workers in the informal sector, as well as freelancers and small business owners. The watch committee, this committee, introduced a compensation scheme by subsidizing those people with a monthly stipend. The compensation method involves a digital platform for aid applicants, asking for their personal details like ID number, phone number, and the evidence of their occupation or their job. The amount for employees affiliated with the social security system would benefit from a 2,000 dirhams monthly allocation, which is about 200 euros monthly from March, April, and May. And if the situation continues, they can also benefit from this amount of money for June. While workers in the informal sector, starting with households benefiting from the medical assistance plan. So in Morocco, this fund helps to support people according to 3 categories. There are a number of employees who are affiliated with the social security scheme or social insurance. They get 2,000 dirhams, and there are informal sector workers who don't have this insurance, but they have what is called medical assistance plan. Okay, who no longer have an income due to compulsory confinement. They receive 800 dirhams, which is over 80 euros per month for households of 2 people or less, and 1,000 dirhams, which is about 100 euros per month for households of 3 to 4 people, and 1,200 dirhams, about 120 euros per month for households of more than 4 people. Okay. The government also suspended payment of all social taxes until June 30, like the end of this month. Banks also postponed loan payments for businesses and households who are facing financial difficulties. According to the professional group of Moroccan banks, nearly 400,000 deferral requests or postponement requests have been processed within a rejection rate of 4%. Okay, so most loans have been postponed. All right. So this is it about the socio-economic dimension of the response. Now we move to the educational dimension. On March 13th, the Ministry of Education suspended schools at all levels: elementary school, high school, university level as well. But it has set an e-learning platform to ensure continuity in teaching and learning. All right. So in spite of the fact that schools were closed, they can learn from distance. But of course, this has created a big challenge. We will see this later. Public television and radio are also programming pedagogical content for students in collaboration with the ministry. So the state public channels during this 3 or now 4 months, they broadcast lessons for students at all levels. There is also an e-learning platform, which is a website that is made for free. No need for data that students can access to continue their education. Volunteer teachers of all educational levels also took the initiative to deliver classes through Facebook Live and or recorded videos in YouTube. Because of limited access to digital tools, there is a risk that the nationwide school closure widens the learning gap between students from the low socioeconomic background and or the rural areas, and those from more advantaged backgrounds. Later, by the end of May, this means that even in spite of these efforts to ensure the continuity of education, there are over 30 to 40% of students in the rural areas who don't have access to phone or to these modern technologies. All right, so it created some kind of social frustration and social disparity among the people. Later, by the end of May, the ministry decided to distribute 1 million copies of books in 3 subjects like French, Maths, and Arabic. The books were aimed to support self-learning for students of elementary schools who are based in rural and semi-rural areas. So in May, the ministry said, "Oh, no, this this method is not 100% ensuring equality." So they distributed books to the students in the rural areas. Among the other decisions that the Ministry of Education took is the cancellation of regional exams, but maintaining national exam, which is called baccalaureate exam here in Morocco. It's a high school degree. It will be held in July. However, all the other exams are either postponed or cancelled. The suspension of schools, though, stirred a dispute between private schools and students' parents' unions. Again, this is another problem, as some private school alliances insisted for regular payment of education fees. Otherwise, students would face penalties. The Ministry of Education intervened lately, just a week ago, and called for mutual understanding between the 2 parties. No final compromise has been reached yet. Regarding higher education research, the ministry launched a program for multidisciplinary scientific research in areas related to the pandemic crisis, for which $1 billion investment has been allocated. The call for paper targets scientific projects which tackle the pandemic from several aspects: medical, technological, social, political, and economic aspects. As a good example of research achievement related to COVID-19, on June 1st, a Moroccan research center based in Rabat, it's called the Moroccan Foundation for Advanced Science, Innovation and Research announced the design of a local COVID-19 diagnostic kit, which is a great achievement in Africa or in the Arab world, in the Middle East and North Africa. Another group of researchers from the Medical Biotechnology Laboratory of the Faculty of Medicine and Pharmacy of Rabat have been able also to analyze more than 3,000 genomes of COVID-19 virus worldwide as part of a national project aimed at deciphering the code of the COVID virus present in Morocco with the identification of several of its characteristics. Results of the study will be published in a reputable international journal, as stated by the head of the laboratory, Azdin Ibrahimi, in his Facebook page. So there is something at least being done in terms of higher education research. But as I said, these achievements, they were not adopted just during the pandemic. It's a long process that has started years ago. Now we move to the role of civil society and volunteers. In times of crisis, the state and civil society in Morocco show a high level of cooperation and harmony, inspired by values of citizenship and participatory democracy. Okay, so in normal circumstances, the government or the state and civil society are not in good relation, but in times of crisis, they go well together because they understand that the consequences might be very dramatic. In the early days of the COVID-19 in Morocco, the government and civil society worked together in mobilizing people about the risk of the virus and introducing them to the precautionary measures in the fight against its spread. For example, local associations launched huge informational and awareness campaign urging citizens to stay at home and abide by the necessary measures such as social distancing, good hygiene, and disinfection. The associations roamed around main streets and alleys using loudspeakers to disseminate their information in a simple language. Okay, so again here, the formal media channels were not enough to inform people about the danger of this virus and also to inform them to stay at home and take the precautionary measures. So the local associations roamed around the streets to ask and urge citizens to stay at home and abide by these rules. The campaign also reached social media as social activists produced and shared widely the same ideas through Facebook, WhatsApp, and YouTube. Volunteering during COVID-19 has also flourished. It took different forms, from awareness campaigns to social assistance and even to hosting stranded tourists here in Morocco. Dozens of hotel owners have also offered their accommodation services to health authorities and local government anytime necessary to host the isolated suspects. Some individuals have even contributed with their Wi-Fi passwords to the children of their neighbors so they can continue learning from home. So this is a sign of solidarity of people. All right, so now we talked about the responses. Now we move to the main challenges which Morocco has faced during the battle against the spread of the virus. The responses were not done easily. They encountered several challenges. We start by the socioeconomic challenge. All right, the precautionary and protective measures imposed by the government of Morocco to slow down the spread of the COVID-19 have had devastating impact on the economy of the country as well as the social aspect of Moroccan citizens. As a result of the closure of borders, as well as commercial centers and non-food related businesses, millions of workers found themselves unemployed, regardless of the financial aid provided by the Economic Watch Committee, all right, through this special fund. The government records unprecedented economic challenges which would have social consequences as well. Moroccan economy depends at a larger extent, and this is what I just said, at a larger extent in the export of agricultural products as well as textile to the EU, which is about 58% of the total exports, in addition to direct foreign investment from the EU, the European Union, about also 59% of direct foreign investment, while the tourism industry generates over 70% of its revenue. 70% of foreign tourists are from the EU. In the present situation, the Minister of Labor stated that over 113,000 companies suspended their activities since March 15, while 700,000 employees suspended or left their jobs due to the same. Moreover, remittances from Moroccans living abroad is expected to drop, while in normal circumstances, about 4.9 billion US dollars is being sent home every year. So the Moroccan expatriates abroad can also, they contribute to the economy in normal circumstances. But now, with the crisis, this is expected to drop. Indeed, the tourism and hospitality sector is the most affected by COVID-19 crisis. The National Confederation of Tourism expects over 34.1 billion dirhams as a loss of revenue from the tourism activities in 2020, and about 14 million dirhams in the hotel and accommodation services alone. The Confederation also expects decline of incoming tourists by 98% in the course of 2020, which threatens the continuity of 500,000 jobs and 5,800 businesses. Official numbers from the Ministry of Tourism show the same fact. The Minister of Tourism, Nadia Fattah, just recently announced that the number of incoming tourists decreased by 45% in the first 4 months of 2020 compared to the same period of the last year. The number of hotel bookings also fell by 43% in the first 4 months of this year. About 95% of hotels and accommodation closed during May and early June. The minister added, the air traffic in Morocco also reduced by 5 million passengers since the beginning of the pandemic in Morocco, according to the minister. The art crafts also export art crafts like handcrafts in Morocco. Art crafts export fell by 34% in the first 4 months compared to the same in 2019. All right, so this is concerning the economic challenges, especially the tourism sector. Now we move to education. The closure of schools due to the COVID-19 in Morocco was followed by e-learning platforms to ensure continuity of the academic year. This is what we just mentioned. Introduction of this learning method was met with criticism by education specialists and parents. First of all, it seems that high and middle income families have afforded the conditions to ensure their children follow lessons and interact with their teachers through information and communication technologies, while students in the rural and semi-rural communities cannot even afford the tools to achieve the continuity of education, such as TV, laptop, smartphone, and data charges. So, as I said, the analysts warned that distance learning, which was adopted by the Ministry of Education, may lead to the widening of social and regional disparities, and it will not achieve equal opportunities between students. Another issue or challenge, which we may add, I hesitated to add it, but then eventually I add it, which is the problem of the Moroccans stranded abroad. Okay, Moroccans stranded abroad. The closure of borders, air, land, and maritime in the early days of the virus has forced many Moroccans abroad to be stuck in different countries worldwide. The Ministry of Foreign Affairs and Moroccan expatriates said that 27,000 Moroccans, excluding those with resident permits. So I'm talking about the ones who traveled abroad for short visits. the ministry also said that the Moroccan consulates were mobilized to assist those people with accommodation. About 5,700 were accommodated, and the expenses were paid by the consulates, which covers about 25% of all the registered expatriates, and often food until their repatriation home. However, the extreme majority of them want to return home, simply as many countries did to their expatriates in foreign countries. For over 3 months, many of those stranded Moroccans suffered from psychological as well as financial problems, especially those who couldn't pay accommodation costs anymore without receiving support. As a result, hundreds of them organized last week protest campaigns in front of Morocco's embassies and consulates in a number of European countries to demand urgent repatriation home. It seems, however, it seems now that this problem is being processed and the government has actually started the process of repatriation. But the Minister of Foreign Affairs, Nasser Bourita, said that the process will be done in steps under precautions, which also requires coordination between consulates, local authorities, and the airline company. So this is it about the challenges. Now we move to the prospects of change beyond the pandemic. What forecast can we say about post-corona Morocco? Okay, the lessons Morocco will learn from COVID-19 crisis are several. This crisis will accelerate the improvement of good governance and public policy. The areas of healthcare and education will receive utmost funding from the state budget in the next years. Moreover, a switch into digitalization is likely to involve public administration and education soon. Last but not least, the present crisis with tourism will push, this is just my forecast, I'm not sure if it will happen or not, it will push the government to reconsider its economic policies by encouraging digital economy, manufacturing and agricultural sector. So I believe that maybe in the next years, Morocco will not depend anymore on tourism or on the fragile, let's say, sectors, but will produce or will encourage manufacturing and agriculture. So investment in the healthcare system. This is what will actually receive much of the funding in the next years. Morocco's health system suffers from profound problems, from shortage of hospitals and beds, especially in rural areas, to lack of adequate human resources, doctors, nurses, and so on. In normal circumstances, most public hospitals are overflowed with patients who, in some circumstances, lack basic medical equipment and care. Results of a survey by the Moroccan Institute for Policy Analysis showed that the majority of Moroccans are not confident about good treatment of patients with COVID-19. And here I would request Murad to show the graph, trust in health system. So we can see, I mean, the respondents or their opinion about their trust in the health system. But I would ensure, yes, this one. Let me just remind that this survey was, or this questionnaire, it was filled by 2,470 participants, and it was filled between March 14 and 19. So still in the early days of the pandemic. So it shows the confidence in the ability of Moroccan hospitals to treat patients. We can see here that 47% do not trust hospitals to treat patients. Okay. They trust just only 3% said they fully trust. But as I said, this was these answers were given in March. If you ask the same question to the respondents right now, I believe the answers would be much different, because I believe the health authorities have done great efforts to treat patients, and the low mortality rate is a great proof. Okay, now we can go back to the normal screen. Regardless of the past efforts to ensure free healthcare services for vulnerable families, the government will accelerate the reforming of the health sector by building hospitals in rural areas and also introducing social and medical insurance to workers in the informal sector. Because there are a lot of workers, especially freelancers, who don't have health insurance. The government may also encourage medical education and offer better conditions for medical training and research, with the aim to benefit from expertise of Morocco's healthcare specialists and scientists. This is, again, very, very important because Morocco suffers from brain drain, and I will talk about this later on. So the government will encourage scientists in the health sector to stay at home and do their job here instead of going abroad. The other prospect is the switch into digital governance and education. Education and research training will also be a top priority for public policy agenda in Morocco. The government will learn from the mistakes of e-learning during COVID-19 and will therefore expand access to digital resources for students in the rural areas. Moreover, higher education and training will be promoted to help highly qualified graduates to meet job prospects, particularly in the field of artificial intelligence, technology, engineering, and biomedical studies. These measures, if taken properly, will help reduce the phenomena of brain drain. And this is what I just mentioned. On this regard, Minister of Education Said Amzazi estimates over 600 Moroccan engineers to leave the country every year. So every year, 600 Moroccan engineers leave the country. Excluding, of course, the other specialists in the other disciplines. Therefore, government will review its education and vocational training strategies to meet the requirements of the job markets. This is one of the profound challenges which Morocco faces. It's the linking of education with the job market. We can find thousands of graduates, but they don't meet the job prospects. And Morocco, Moroccans recently they felt very much sorry, and they expressed sorrow for the migration of Moroccan scientists, especially after they saw that the president of the US, Donald Trump, appointed a Moroccan scientist who was born here, who studied up to the 6th grade, but moved to Europe. So they learn. Of course, they would learn from this mistake. The next prospect, and the last one, is the reconsideration of Morocco's economic policy by generating alternative approaches to development. So in line with the COVID-19 crisis and the economy, we have learned that some traditional economic activities proved fragile, including all tourism-related activities. Of course, the COVID-19 is an example, of course, and the other example of the fragility of the tourism industry in Morocco is the tourism threats. Even though Morocco is relatively safe for tourists, but the sentiment or the news that come from the Middle East and from Libya, not far from the country, it may actually make prospective visitors afraid, and they may not trust the situation. So it shows the fragility of the tourism in the industry. Therefore, I expect from the government to seek alternative sources for the economy. Besides agriculture, manufacturing, and business, either foreign or local, Morocco therefore looks to generate new approaches to socio-economic development through investment in digital economy by opening up to ICT tools and artificial intelligence. However, this potential shift requires, though, unprecedented efforts, a lot of efforts in training, and will likely take a long time before it reaches its goals. Now we move to the conclusion. As a conclusion, like any country in the world, Morocco experienced COVID-19 with exceptional measures and quick responses, which are often praised by foreign media. Thus, thanks to these measures, Morocco managed to avoid almost 200 fatalities and thousands of infections every day, according to the Prime Minister Sadygzade Al-Uthmani. So despite of all these challenges with education, with like loss of jobs, Morocco has avoided the worst step of the virus, or the worst period. And according to Sadygzade Al-Uthmani, who is the Prime Minister of Morocco, over 200 fatalities or deaths were avoided thanks to these measures. It seems like Moroccans in general approve the state of health emergency measures to stop the spread of the virus. The results of the survey by the Moroccan Institute for Policy Analysis, so the same think tank, showed that most Moroccans are satisfied with the government measures. And again, I would like Murad to show public reaction to COVID-19 graphs. So we can see to what extent Moroccans agree with the measures that were taken by the government. Public reaction to COVID-19. Yes, this one. So I explained the first figure. Here we can see that Moroccans in general agree with the communication strategies adopted by the government. About 50% of the respondents said that the government communicates well. About 21 said that it communicates very well. So it showed that the government have adopted a great communication strategy to inform people about the danger of this virus, and second, to let's say warn them and to tell them about the precautionary measures like good hygiene, social distancing, and so on. And for the first time in since long time ago, the public TV channels, they used local dialects instead of the official standard Arabic to address the people. They used the Moroccan dialect because not a lot of people, especially people in the rural areas, understand the standard Arabic, and they also used Tamazight or Berber languages. So as everyone will understand what's going on with COVID-19. Now, next slide, please. Again, this slide shows the same as I said earlier. The public media's communication regarding coronavirus. Everyone almost is satisfied. Next one. The degree of satisfaction with the measures taken by the government to respond to the coronavirus. So here about 30% said they are very satisfied with these measures, and 47% said that they are satisfied. So the majority are satisfied with the measures. Next one. And again here, the confidence in Morocco's ability to respond to the coronavirus is almost the same as the previous question. Also here, they do trust, the majority trust the government to respond. So about 15% together with 43 said they trust. So almost the majority. And again, here this 33% who do not trust this questionnaire, it was sent to the respondents in early days of the pandemic. So if you may have asked the same question right now, I'm sure the answers would be different. Next one, please. Here it's the degree or the endorsement of procedures to prevent the coronavirus. So here it shows some categories of the measures or some like actions that the people have taken to respond to the virus and to help protect themselves, like suspending private and public schooling, travel ban to and to and from Morocco, prevent large gatherings. So all these, I mean, these measures were largely endorsed by the majority of the respondents. I think this is the last slide, right? Okay. However, the challenges caused by this crisis continue and may not heal instantly. Its effects have been dramatic, not only at the level of the country's economy, but also at the social aspect, regardless of the efforts to mitigate these effects. Nevertheless, the post-corona Morocco is likely to change, especially on the way public policy and governance are performed. That's the end of my presentation. I am ready for your questions. Thank you for your attention.
Thank you so much, Hamid. It's really great. Just a minute. So, dear colleagues, now we are moving to question and answer session. But before I will let my colleagues and Professor Vishnyakova ask a question, I want to use my priority as a chair of this session. And I want to ask, during your speech, really, I'm surprised. Why? Because firstly, I know the situation that Morocco is the second non-oil GDP in Arab world. Really, Moroccan economy is so good because it's so diversified. According to about 15% in agriculture, about 10% in tourism. Also, the Morocco is one of the, as I remember, in world the third largest exporter of
phosphates.
Yes,
phosphates. Yeah.
And there are a lot of connection with European Union, especially with Spain and other states. But even in United Arab Emirates, with the higher GDP, they can't handle with the situation like in Morocco. How is it possible? How much money your government need to restore the situation? Because according to your speech, it's about maybe 3 months of lockdown. It's not only lockdown; it's a state of emergency. It's delays in loan payment. It's delay in taxes, canceled some payments. Really, it needs a lot of spending on public policy. How is it possible? When you find this money?
I just said it's very simple. The answer is very simple. The fund that was launched by the King of Morocco have helped very much to mitigate the social consequences. As I said, this fund was a contribution of almost everybody, the governmental and non-governmental organizations, the businessmen, CEO of large corporations, banks, and individuals as well. Also, Moroccan expatriates abroad have contributed, right? This is one. The second one is the request of loans. Okay, I mentioned that I don't remember exactly the amount of money, but Morocco requested loan from the IMF, and just yesterday it requested another loan from the World Bank. Of course, this is according to a partnership between the Kingdom of Morocco and these financial institutions. But this again will pose questions like, when will Morocco pay back these loans or these debts? Some economic analysts warn about this danger because it may again change its financial policy by increasing taxes and trying to reduce expenditure by the government in order to produce an amount of money so that it can be paid to the financial institutions. However, the other irony is that in spite of this request of loans, Morocco has started to send medical aid. In the recent days, it sent like 18 tons of medical aid to over 15 African countries. So it creates some kind of confusion, some kind of let's say, not understanding well the situation, but I believe that Morocco is not only trying to heal the situation with COVID, but also try to benefit from it, right? Diplomatically.
Yes, it's a part of soft power. You know, it's important now in the era of pandemic. It's important. Now, I think, thank you for your answer. It's really interesting for me because, you know, I compare the situation with the measures adopted by Jordanian government. As you know, they also, their situation is also the story of success. But they have, how to say, more money and ability. For example, they have some loans, not loans, it's like low tax payments from United Arab Emirates, Saudi Arabia. But for I know that now the situation between the relation between Morocco and Saudi Arabia and United Arab Emirates is not so good because you have some political misunderstandings. Thank you for your answer. Now I give to our professor, Dr. Vera Vishnyakova. Dr. Vishnyakova, you have question, maybe comments?
Thank you very much. It was very interesting and informative. Yes, I have a long list when I prepared to our meeting.
I saw you writing down.
I have prepared a long list of questions, but after your presentation, this list, consists of maybe 2 or 3 questions. Yes, only the errors. Yes, I know that, and you know that now the situation with COVID-19 has brought some disadvantages and advantages to the government of different countries. Especially, you know the situation in USA, and you can comparison with your country. What do you think about the, what do you know, or what could you say about the situation in Morocco? What advantages or positive points the government have the government of Morocco found from this situation with COVID-19?
I'm not sure if I understood your question correctly, like the advantages and disadvantages, or only the,
advantages or maybe disadvantages, because you know that some governments in different countries really lost their position, as USA, for example, Trump, after COVID. And what about the Morocco government? Have the government found from this situation maybe some positive points or maybe negative points? I mean, about the support of the citizens.
So I would start first with the disadvantages. The disadvantages are the challenges which I mentioned, which are related to some, let's say, some problems with public policy, especially the social policy and also the educational policy. So the COVID-19 have revealed this problem more, and the experience with the e-learning, for example, or distance learning, shows that there are some let's say some negative points that have to be addressed. As I said, it can stir social disparities. It can encourage, let's say, social injustice. I would say some students may be well educated. They may benefit from all these technological tools to continue their education, while some other students they don't have the tools, even though they may have the intellectual capacity, but they don't have the tools. So the government now is, as I said, this is one of the disadvantages. The other one is related to the social policy. As I mentioned, many like thousands of businesses and say companies were forced to suspend their activities, and many workers don't have even the social scheme, the insurance scheme, only the ones who work in proper businesses. And as an answer to your question, just yesterday the Prime Minister delivered a speech in front of the Parliament, and he said that he learned the lessons and that he will work to ensure social insurance to some of the workers in the informal sector, like workers in the agricultural sector, owners in grocery stores, for example, professionals in the tourism industry, tour guides, and so on. So this is a disadvantage. Now I go back to the advantages of COVID-19. Advantages are many. As I said to Murad, Morocco, within this crisis, it tries to establish itself as a regional power in Africa, and it has always maintained this policy. Morocco, since let's say 2014, is moving towards investing in Africa. Not all the African countries, of course, but the Francophone African countries in particular, they invest in it so that it reinforces its position in the African political, let's say, landscape. Okay, and the distribution of the medical aid to 15 countries is one of these advantages. The other advantage which the government has also learned from this crisis is the trust that appeared between the citizens and the state. Okay, in normal circumstances, as I mentioned during the presentation, relationship between these two actors it's not fine, right? But in times of crisis, we see a strong level or high level of solidarity through donations by individuals, right, to the fund, and also through social initiatives to help the poor. We have seen in many cities many initiatives by civil society organizations, local associations, delivering some let's say necessity tools like grocery, say food, for example, or some medical equipment to the poor or to the needy people. So this solidarity between the government and civil society is being strengthened. Regardless of the problems, we gain this trust. And as we see, we have seen in the graphs, we have seen a high level of confidence and trust with the government measures. So I hope these answers answer your questions.
Okay, thank you very much. And yeah, it's very interesting, yeah, how to compare this situation, advantages and disadvantages, and really Morocco government and Hamid, you are very positive to think about the future, yes, in comparison with our government and with the Russians.
Confident.
Yes, yeah, but I find some maybe contradiction point in your presentation. You said that the citizens support, the citizens don't believe, don't trust in the treatment of the hospital, yes, or medical treatment, but they really confidence, they confident to the government communication,
measures.
Yes, to the government information about the COVID. How can you compare these two position? I can't understand.
Yes, it's a good question. Actually, if you followed my presentation when I talked about the situation of the health sector, I'm not saying it's great. All right, it's bad. Of course, compared to the other countries in the region, in North Africa, it's among the best. All right, but when we compare it to the other countries in Europe, for example, it's still bad. Right? Everybody knows this. With the shortage of hospitals, lack of human resources, doctors, nurses, and so on, and also the increase of private hospitals, which doesn't give room for the vulnerable people to benefit from the healthcare services. And we actually have seen in the early days of the pandemic, some patients with COVID-19, they were filming the situation inside the hospitals, and it was not good. They have filmed like they have seen garbage somewhere there. It's not clean. They demanded some care. Nobody cared about that. But soon the health authorities denounce these videos and they say no, these are fake news, right? And they give another explanation. But if you see in the graph that shows the trust in healthcare, it was answered in early March, right? So in the early days of the pandemic, at that time we don't know whether the hospitals and the health system in general would treat these patients, right? But I am confident that if you ask the same people about their trust in the healthcare, with if they would treat them well, they would say yes, they did, because of the low level of mortality rate, high level of recoveries. I'm sure that the authorities have done well, and that this is also because of medical protocol that have been implemented by the health authorities to use the chloroquine, say pills, to treat the patients. All right, in spite of the controversies with this medicine, but it proved to treat the patients well. So this is why you've seen this contradiction. The respondents are confident about the measures, but they are not confident with the health system of the healthcare response.
Yeah, thank you. And I have one more question about the second wave, yes, of COVID-19, because there are a lot of people who say that it will be this autumn. And what about the citizens and the government of Morocco? Because you know that maybe you know from the news that Beijing declared military law in the city, and it's really a good example that the second wave will come this autumn. And
we hope. Sorry to interrupt. We hope it will not come.
But if it will be, yes, if it comes, what do you think? Do the government and the citizen of Morocco respond the really second difficult situation, such? I mean, maybe in economic way.
Economically, yeah. So far, in the present situation, the government is relaxing the confinement measures, and the state of health emergency is due to July 10. So there is no intention by the government, or no actually signs that the government is ready for a second wave of the COVID-19. For the present situation, the government is trying to rebuild its economy by reopening the businesses, by allowing people to go to work. Now the public administration are back to function. However, there are strict laws or rules to be abided by, like good hygiene, wearing face mask, and ensuring social distance. So the tendency of the government now is going to live with the virus and trying to strengthen the healthcare system by testing more people, right? Increasing tests and allowing people to work. However, under these conditions, I'm not sure if Morocco is ready financially or economically for a second wave of the virus, but time will, of course, tell us. If it comes, then maybe further actions will be taken. And as a last information that the fund that was created to support people who lost their jobs, only 10 or 15%, if I still remember, that has been spent. So about 70% is still, let's say, not spent.
Yeah, thank you very much. Yes, the time will show us, but we must be ready for positive and negative yes scenario.
Yeah,
Murad, the floor is yours. Thank you very much. Hamid,
thank you.
Welcome, Dr. Vera.
Thank you so much for your question, Dr. Vera. It's really interesting. And I also maybe add something, try to clarify. When you said about government, you mean the government of king, or like the government and king?
All right. So when I talk, when I say the government, I mean prime minister and the ministers. All right, not the king. All right. Okay. Yeah. Even though this will bring me to talk about the let's say the divide of power among the state. All right, the king is the head of state, and the prime minister is the head of the government. Right, the king has more powers than the prime minister.
Yeah.
Even though along with the Arab Spring revolutions, a new constitution was adopted which gives more powers to the prime minister. Okay. Yeah. But it's great that both, let's say, governments, I would say, like the king or the monarchy or the palace, along with the government, cooperate in times of crisis. The fund that was launched, it was an initiative by the king, and many people contributed to this fund. All right.
Okay. Thank you.
Yeah. I hope the picture is clear, because if
no,
I have to talk...
I understand. Yes, I know the structure of government in Morocco, because as you know, I'm in Middle East, specialist in Middle East studies. I just want to say that if we think about talk about king, it's a different situation, because it's like a tradition of trust to king. But for government, because everyone with something going worse, the old people said that it's not the fault of king, it's the fault of government. It's okay. Now I think it's time to go to our participants. Maybe they want to ask some questions. Dear colleagues, you can write in chat or maybe turn on your microphones and video and ask your question. But before ask, please introduce yourself. Good day, Saleh.
Saleh, yes, Saleh Sibli. First of all, thank you very much for your lecture. It was very informative. Again, just to introduce myself, I am Saleh. I am second-year master's student in Moscow State University. I also specialize in Middle East. So, and my question is following. I have a question regarding the statistic. So when you talk about the number of deceased, the number of infected, do we talk about people who live in internationally recognized borders of Morocco, or we also add people who live in the Western Sahara? I mean, those areas who are controlled by Morocco. And the second question is, what about the people who live in Polisario-controlled Western Sahara? I mean, do Morocco help them, or they are basically on their own? Thank you very much.
Okay, thank you very much for this question. So the statistics I gave, they cover the map of Morocco, including Western Sahara, right? It is administered by Morocco, and it is part of the Moroccan sovereignty. However, the communities in the Polisario camps, these are located in Algeria. All right, they have nothing to do with the statistics which I mentioned. So they are part of Algeria. Yeah. Did I answer your question?
Yeah, you answered my question.
Okay, welcome.
Thank you so much. Dear colleagues, maybe one more question.
No question, yes.
So,
if I have an opportunity, may I ask another question?
Of course, sure.
Please.
You can do it.
Again, I just had a question. Maybe you have covered this in your lecture, and I'm sorry if I missed it.
Yes.
If you look at statistics of neighboring Algeria, you would see that number of people who died there are 3 times higher than Morocco's. despite the fact that number of infected is maybe 1,000 or 2,000 more, but the number of those who deceased, who died, are three times higher than Moroccans. So what do you think the main reason behind it? Was it the late response of Algerian government, or is Moroccan government has been more effective? Has Moroccan government been more effective?
It's a difficult question because I am not in knowledge with the COVID-19 in Algeria more, but of course in Algeria the fatality rate is higher than in Morocco. But I can give you an assumption. In Morocco, as I mentioned, the health authorities, they have adopted the chloroquine, let's say, medical treatment as a good way to treat the patients, and this has been certified and proven by the Ministry of Health. And also the second reason, which I missed to cover, is the system of tracking prospective patients or infections. So with the help of the app, the Wiqaitna app, the app that can help to trace prospective patients, we can find or explore cases without even symptoms. Okay, I did give the statistics about this, but I can assure you that in the last weeks, up to 70% were discovered without symptoms. Okay, this is one. The second one is also the tracking of the possible infections around a confirmed case. In Arabic, al-mukhalitun. This is the term in Arabic. It's like when a confirmed case is confirmed, right? Then the health authorities does not wait until a new case comes with symptoms until they get calls by prospective patients. No, they go around the neighborhood, they block the neighborhood where this confirmed case is found, and then they do tests to all these people. This is called the epicenter, right? So it also applies to places of work, and this is why you have seen in the diagram this dynamic, right? Like a mountain or a series of mountains. So it's because of epicenters that were discovered, and the government tests all the people who might be in contact with the confirmed case. And this helps to increase the number of recoveries and also decrease the number of deaths.
Yeah, thank you. You have answered my questions. Thank you.
Welcome, welcome.
Hamid, dear, if you
Yeah.
let me, I want to add about the Algerian case that the problem of Algeria in some misunderstanding and how to say, there is no consolidation between government and population. I mean, ordinary citizens in Algeria, because as you know, maybe Saleh, according that maybe last 6 months, there are a lot of protests. Even now during the pandemic, there are a lot of protests. The second maybe indicators, it's a difference in amount of population. It's about, in Algeria, about 10 million more than in Morocco, if I'm not mistaken. And the second question, or the third question, is a problem in health system. As you know, in Algeria, unfortunately, they don't have enough investment in public sector. It's a great problem after the Arab Spring, because they don't attract a lot of investment, especially from European countries. But Morocco stays stable in these terms. So, dear colleagues, maybe one more question. I think your speech was really so overwhelming and interesting. Perfect. I want to ask.
Some of them are maybe shy to ask questions.
I don't think so, because
they can type their question, and they can answer.
Dear colleagues, yes, if you want, you can write in chat. And if not, I want to ask our last question. It's our, how to say, mainstream question from our School of International Regional Studies. It's about the fate of globalization. Generally, this is a question of Dr. Vera Vishnyakova. Now, if you let me, Dr. Vera Vishnyakova, I want to ask this question.
Of course.
Dear Hamid, what do you think about the future of globalization? Will it change? Maybe will it cancelled? Will it end? Just maybe.
Yeah.
How to
What
say?
is the
Yeah,
fate
yeah.
of globalization? It's
Yes,
really
briefly.
Okay, it's a good question as well. You bring me to talk about a competition I participated earlier. It was organized by the Islamic Council country. I don't know how it's called, and it. The question was what would happen in the post-corona world, and I made a video, but unfortunately I did not win. In this video, it doesn't matter, and I explained the future of globalization. In my perspective, with the rise of China and the challenge of like the Eastern or the Asian periphery, and also with the protests that are still going on in the United States of America, I believe that the globalization will be in multi forms, like the global order will be done, or it will be manifested through let's say multi actors, right? So there will not be only one big giant superpower, but I believe that global governance is going to be run by multiple countries or powers. And the time I spent there in Russia, it also helped me to understand and to reinforce this maybe assumption or theory, because I participated in some projects related to BRICS. I believe the BRICS is also a challenger to globalization as what we witness today. So, however, the future of globalization, it will be in the long term. I mean, the effect or the changes can be seen like in 10, 20, or 30 years from now. But in the near future, the whole world has to find solutions with the economic crisis, recession, and so on. So the future of globalization, I believe, is going to be, let's say, managed by a series of conflicts between the big superpowers, the US, China, Russia as well, and the regional powers.
Okay, thank you so much.
I want to add some about the globalization, because we think about this question. We are thinking during 3 months and asked our speakers about this. And I noticed that the globalization has changed their forms. If we speak about the economy of the countries, we can say that we really see the regionalization. Yes, regionalization, and really the big actors change their roles, and another, for example, then the South Asia, yes, has becoming very strong. But if we say about the society, the level of society, the level of communication, the globalization is really has become strong, yes, and now we don't have any borders in communication because of online communication, because of Zoom or something else, some of these products. And I think that we will see in the future the new form of communication, not only between the countries, but between the people. Yes, maybe we will see the new level of communication. As a philology, I'm a specialist in philology. I think I'm a linguist in Korean language. I'm specialist in Korean language. I think that we will see the new form of communication without any borders and without any economic maybe points. Yes. It will be really a new society. Yeah.
Of course. Yeah.
Thank you so much.
And the COVID-19 is maybe going to be the engine of this change. It has started like since long time ago with a low, like a slow motion, but the COVID-19 is going to change it very quick.
You know, Hamid, According to your answer to question about globalization, it seems to me that you are a student not from the social science faculty, but from our faculty of world and international affairs.
Yes.
Because it's our main trend that we, our dean, Professor Sergei Karaganov, also every time said that our world going to some multipolar system, and where is a lot of center of power, and it's really, we hope that it will be soon, of course, and we can see it. About the changing, Dr. Vera Vishnyakova, in type of communication between people, you know, I'm frankly miss you all so much because I want to see you, to speak with you, to laugh with you, and now, unfortunately, how to say, of course, this Zoom or another, how to say, ways to communicate online is good, but you know, there is no soul in this communication, unfortunately. But I hope that it will, how to say, come to usual and classical form of communication, because it's also important for us. And Hamid, we are hope to see you in Moscow. So as I said you before, yes, inshallah. إلى اللقاء في موسكو يعني.
Thank you very much for your really warm presentation, and I think I don't know about our guest and Murad, but I really have felt the warmth from you from the Zoom, maybe for the first time. Thank you very much.
You're welcome. Yeah, it's been also a great pleasure for me. And just as a quick comment to what Murad say about my like specialization, that I know more about. Let's say international affairs or international regional studies, because I did not only study public policy, I took some classes also from your school. Okay, I studied the course of global governance by Professor Kozlov. I still remember. Yeah, and I also attended some lectures by Professor Karaganov, I mean, recently. So I am familiar with some of the faces in your school. Yeah.
Thank you so much.
Thank you very much.
It was a great pleasure for me.
Colleagues, really, it's too hard to, how to say, to end our communication, because it's so sweet and so interesting to talk with you. We can do it till the end of this day, but unfortunately we have already 2 hours of our online lecture, and I think it can stressfully impact on our health, and now we should sum up. First of all, let me thank you, dear Hamid, to accept our invitation. Thank you for your support, for your interesting questions. Interesting answers to question of our participants. Thank you to our participants to take part, to be with us today. And thank you to Dr. Vera Vishnyakova and Professor Sergei Karaganov to support these events. It should be mentioned that it's the 17th meeting in series of our workshops, and it's really great pleasure with with Dr. Vera Vishnyakova. We had a lot of interesting meetings before. Of course, the majority of them were about the coronavirus in different parts of worlds, and it were really interesting. It was really interesting. But now it's our final meeting about coronavirus. Our next meeting, yes. We hope that we will overcome this situation. And one more time, thank you all for your participation, for your precious time, and that you share your ideas, opinion, and answers with us. So thank you so much. If you want to add something, please.
Thank you, Hamid, and you are welcome, yes, to our seminars.
Well, I just hope that this coronavirus will finish soon, so that people will get back to normal life.
Normal life, yes.
Yeah, this is what I hope. This is my final words.
Yeah. Thank you very much.
Welcome.
إلى اللقاء عزيزي.
مع السلامة. مع السلامة.
Bye bye, dear participants. See you next time.